Hi everyone, thanks very much for joining us again today. Today I have with me the Academic Director from our South Africa Community Health and Social Policy Program in Durban. And John, would you like to introduce yourself for us?
Yes, my name is John McGladdery. I've been working with SIT now for 18 years, and for 10 years have run their community health program out of Durban.
Thank you very much. And can you go into a little bit about what your role is for us on the community health program in Durban?
Yes, as academic director, I see my role as providing something which students from the US cannot get back in their home campuses. I want our students to develop nuanced understandings with regard to the provision of health. And I think that there are certain key areas in which the South African experience is extremely relevant to the experience that some communities in America have as they try to access healthcare. I see my role not as teaching American students about a different medical system, but I see my role as allowing students to understand the answers that one can obtain when one is exposed to new ideas in a different context. And those answers are as relevant to the questions in South Africa as they are to America and indeed the rest of the world.
That is a perfect segue to my next question, which really has to do with what you think the uniqueness and our benefits of studying this topic of community health in Durban and in South Africa in general are for American students or international students.
Well, I think that most people will know that South Africa is the epicenter of a long-running HIV epidemic. And in South Africa, we have excellent world-class research facilities that have been providing us with excellent data on how to tackle this epidemic. But the important thing which this data is telling us is that we need to provide those answers not to the doctors and the health workers themselves, but those messages need to go out to the communities. And so the way that we teach community health is from the community level up. Public health, the broader discipline that you can learn a whole lot better by staying at some of your excellent institutions in the US, looks at the herd, it looks at the large numbers, so that decisions can be made that will improve the health outcomes of large portions of the population. What we've learned in South Africa is that the messaging that goes into any of our promotion and prevention campaigns really needs to be specifically targeted at communities. And communities engage with their own health and engage with health care providers in many different ways. And if we don't understand the communities, don't ask the communities themselves how they perceive their health issues and how they perceive those solutions, then we find ourselves in a position whereby we have the answers, but we're just not able to present them to communities in ways that are acceptable and accessible to them.
That seems like your students really get to experience the saying nothing about us without us well in South Africa.
Certainly. The world is full of experts who think they know how to deal with the problems from the macro level. And we challenge that. And we say that have a look at what is happening in some communities. Despite us knowing how to help these communities, they are still in the same position as they were 10 years ago when we figured out our plans and thought that we knew the best way to deliver those health services to them.
Excellent. Now I'm going to change topics a little bit here.
Mm-hmm.
Well, maybe throw a hardball at you, but what would you say is the most exciting aspect of your program for incoming students to Durban?
You know, I think that we have two aspects which are exciting. The one is that Durban itself is an exciting place to go to. We have beaches. We hope that we can show you some elephants and give you some fun while you're there. HIV, disease, these are very serious issues that we do certainly grapple with during our lecture series, and we will go out and we will see people who are living in quite desperate circumstances. But I don't want my students to expect that they're going to have 3.5 months of tragedy which comes before them. The beauty about South Africa is that we have solutions. We have people who are doing tremendous work. And I will show you some nurses who get paid very little, haven't got the same education as you might have had, and yet they are doing tremendous things in their communities. And so I think that the exciting part that I have is that I will introduce you to South African humanity. We have not got the same resources that are available in the US and in the developed world. But I hope that, and I do see it, that when students leave the program, they realize that the greatest resource is a motivated person who knows how to speak with the community and can assist community members to take control of their own health.
That sounds truly like it's an amazing opportunity for the students. So now, as we come to the end of our interview today, I just want to ask if you could reach through this little television screen that we have and talk to the prospective student who may have decided on a community health theme or may have decided on South Africa, why your program would be the one to choose, or maybe something along the lines of you want to tell this to the prospective student out there.
Yes. I think that if you're coming on this program because you're looking for an alternative, perhaps an antidote to evidence-based medicine, I think you might be a little bit disappointed because, as Carl Sagan said, the essence of scientific method is to first entertain the possibility that there are many, many solutions out there and look towards those possibilities without any cynicism. But once one has opened one's mind to the possibilities that might be out there, one's duty is then to subject those to Ian, I'm not making any sense here. You're going to have to ask that question again. Thank you very much.
Okay, I definitely will. Don't worry about it. So if you could give the incoming student or the prospective student one bit of advice while they're trying to decide on a program in Africa or in global health, what would it be?
I would say to prospective students that one should leave one's expectations, the power that you might have, and check those in at the airport. The students who gain the most from this program are students who are prepared to engage with new ideas, who I don't expect any student to leave their own constructed identities behind them. I want you to bring all those identities so that we can have a classroom space where your own constructed ideas can form part of the conversations, but also can be weighed up and reformulated according to the new ways of seeing and the new ways of being that we will expose you to on the Durban program. With regard to travel to South Africa, I would really urge you to understand that although there are some issues with regard to personal safety, I'm a father myself. My daughter Candace and my son Duncan and my wife Christine, we live in South Africa and we live very, very safely and we have wonderful lives. I'm going to bring you into homes where you'll have homestay brothers and homestay sisters, and we are fine. We are safe because we understand the context. And so I know that there are many worried parents out there. So I hope that you show them this video, and I present myself as a family man who is very much interested in your safety. And if you listen to your father, you'll definitely find that you can have a very fulfilling experience and have a lot of fun while you're learning in South Africa.
That is always important, because the fun tends to drill home the academic message as well. Well, thank you very much, John, for taking some time today, and I will let you know if any prospective students have some questions for you.
Much. I'm always willing to answer those.
Have a good afternoon.
Bye-bye.